Here we go.
Good morning and welcome to the Alvin Manville Area Chamber of Commerce in our virtual town hall. It is our pleasure to partner with Community Health Network, and we're going to talk about vaccines for the next 30 to 40 minutes. So you'll be able to ask your questions. You'll be able to put them into the comment section, and we will ask them. But we really appreciate Community Health Network for what they're doing in the community to help get vaccines into arms of our community members, and we really appreciate you for tuning in. So just a reminder, this will be placed on our YouTube channel later, so you can go back and watch it on Facebook, or you could watch it on YouTube. So without any further ado, I'm going to go ahead and introduce Dr. Yvette Poindexter to you, and then turn it over, and we will go ahead and get started. But Dr. Yvette Poindexter is a board-certified obstetrician and gynecologist. She's the Chief Medical Officer for the Community Health Network, and she has been since 2010. She graduated from the University of Texas Medical Branch School of Medicine, and Baylor College of Medicine is where she did her residency until she then turned out to pursue a master's in business education in healthcare management. Dr. Poindexter is responsible for clinical and financial growth of a federally qualified health center with multiple sites. Since her arrival, she has helped to implement women's health in Brazoria, Galveston, and Harris County service areas, including Alvin, Freeport, Pearland, Lake City, and the Houston area. Dr. Poindexter's greatest strength is her commitment to the mission of providing health care to all people without prejudice, regardless of their ability to pay. This in particular will allow patients to be successful in their medical management and preventative maintenance to transcend barriers. And Dr. Poindexter, we certainly appreciate having you here today, and I'm going to turn it over to you and let you kind of start us off with giving a little opening statement, and then we'll start asking you questions.
Okay, thank you. Thank you so much. Really thankful and grateful to be here today. It's always an honor to represent Community Health Network, and an honor to be here to, talk to the community. That is what I took an oath to do, is to help persons, but it's even come on a higher plane today where we're just in the community trying to assist persons with their medical care, dental care, behavioral health care, and now, get us through the pandemic. So here we are at the point of, COVID came into our lives about a year ago, and now here we are with vaccines. So I believe one of the things that I'm here for today as a representative in the community is to, let's get rid of some of that hesitancy about taking the vaccine. Let's build up the confidence about taking the vaccine. Some of you, I'm sure, may have had the vaccine. I know I've had my first and second dose as a healthcare worker. So let's talk about it today. Are there fears? Are there questions? If you're on the fence about taking it, how do we get there? Because if we're all not one as a community taking it, and we're speaking of Brazoria County, we really have to get about up to 75-80% of all of the community getting this vaccine, so we can create the herd immunity. But it's not just our community. We have to make this work across the nation. So let's start here.
Great. Thank you for that. And I'll just go ahead and get a couple of questions started. And then as they start to come in, again, if you're watching us on Facebook, go ahead and just share your question in the comments, and we will go ahead and ask that. So I heard the FDA granted emergency use authorization for the Pfizer vaccine. What does that mean? Is it safe?
So as we talk about the vaccines, I'm going to speak on behalf of both of the vaccines today. There are two vaccines, the Pfizer and the Moderna. vaccines that have been emergency authorized for use. And both pretty much, they have the same profiles of being safe and effective to use. The way the clinical trials were set up, where they needed to determine whether or not these would be, it would fight off against us as persons in the community, persons period, getting ill. So that's what the vaccine is for. It's for us not to get ill from COVID-19, to prevent severe illness and going into the hospital. So when they did the clinical trials, there are different phases that you have to go through in a clinical trial. And I will tell you, they did not skip any of the phases. So that's something we can talk about, because it was called warp speed. And persons, people thought, well, they skipped some phases to get to this vaccine. And they did not. When you get to the certain phase where they did, they enrolled the number of persons they needed to, Pfizer and Moderna, and they showed that it was safe and effective, and it could prevent illness from COVID-19 95% of the time. Pfizer's was 95% effective, and Moderna is about 94.6. So I say they really have the same profile. So the FDA and an external committee of the FDA said, you know what? We like this. They reviewed it. Like I said, they had an external panel as well, and they said, you know what? We can go ahead and release this as an emergency authorization. So that's why I call them vaccines, because it's your choice to take the vaccine at this time. It is not mandatory at this time. When the FDA does see more information from us taking the vaccine, then, at some point, I'm sure it will become FDA approved. Then it may become part of your immunization profile. So that's just how we got to the emergency authorization use of the vaccines.
Thank you for that. I know a lot of people talk about when they get a flu shot that they sometimes get flu symptoms. Can I get COVID-19 from the vaccine?
No, you cannot. So these vaccines are different. And again, when I reference them, I'm going to speak on Pfizer and Moderna. So the vaccines at this time that are released, they are different from most of our immunizations or vaccines that we already have in use. This is not a virus. It is not a vaccine that introduces a virus or COVID-19 into your system. So you do not get COVID-19. The way these vaccines work, they work through messenger RNA. So it's a little part of the I guess like a protein of COVID-19 that's introduced to you through the vaccine, and it creates spikes of protein immune response so that we can fight against it. So, a lot of persons are scared. I've heard that before. That's one of their fears. Well, I get bad symptoms when I take the influenza vaccine, and so they don't want to take this one. Well, that's a virus, yes, that vaccine, but this is not a virus. Now, will you get some side effects? It is possible. There are probably about 70% what they found. There might be some tenderness in your arm, sometimes soreness, sometimes a little pain, but those things pass. They usually pass within about 24, 36 hours, around then. The other is that you might get some body aches, some low-grade fever, some chills, but these are very minimal and not as common as the tenderness in your arm. And they're not the symptoms of COVID-19. They're the symptoms of your immune response fighting against this protein so that it can build up immunity in your system.
Thank you for clarifying that. That is very helpful. You've mentioned both the Moderna and the Pfizer vaccine. Obviously, they both have about the same effectiveness. Are they interchangeable, and do I get to pick? And how do you determine who gets which vaccine?
Maybe one day we'll get to that chance to pick which vaccine we want. However, right now, there is limited availability. As we've seen the transition occur, we are, hoping that we're going to see more vaccine availability, more manufacturing upcoming. So that may be coming. Right now, the difference between Moderna and Pfizer is the way it is stored. So you'll see most of the hospitals or the big entities get the Pfizer vaccine because it needs to be stored at a very cold, freezing temperature that, your communities normally don't have that type of storage. So we usually in the communities get the Moderna vaccine. The Moderna vaccine can be stored in your typical freezer, the way that not your home like freezer, but your typical storage that we do for most vaccinations. So you'll see as you call around, if you're registering at a pharmacy, or you're getting your vaccine from the hospital, or you're getting it from Community Health Network. A lot, you'll notice that they'll have either the Moderna or the Pfizer, and those vaccines are not recommended to be interchangeable at this time. So when you receive one, you want to stick with that same one. And so that'll be a question on your second vaccine, which vaccine did you receive the first time?
Thank you. So we've gotten this question. A few people have texted me that have had COVID-19. So if you've already had COVID-19 and recovered, should you get the vaccine? And should you wait to get it, or how does that timing work?
That's a great question, because what we've seen is that persons who've had COVID-19, they do build up an antibody response in their system. They build up immunity. The problem is we don't know how long that immunity is going to last. Some of the following of the studies, I should say, thus far have shown that 90 days. I've seen some persons have immunity even longer than that. So we don't know, when our immunity will end if we've had COVID-19. So the recommendation is to get a COVID vaccination. The recommendation presently is if you have any symptoms of COVID-19, or you've been quarantined, isolated, that you wait until after that period. If persons have been treated with therapeutics, they have monoclonal antibodies out right now for mild and moderate COVID-19 disease. If you've had that therapeutic treatment, then you need to wait 90 days. So for the most part, if you're not in an essential position to be exposed to COVID-19, you could wait a little bit to get the vaccination. I would not wait, after that 90 days, because like I said, you may not have immunity after that, but it is still recommended, that you get that vaccination.
Thank you. Do you think eventually, or do you already know, will the vaccine be given annually, like a flu shot, like after we get through the initial getting everyone that wants to be vaccinated?
We have to get through that initial getting everybody vaccinated. So, with the limited availability of vaccination right now, We may not even see vaccination of all until, later on in the summer. That's what we're hoping. We have to get 300 uh, million vaccines, going to make sure that we can get everybody vaccinated. There is, these studies, and I say studies because we're in the emergency use authorization phase. We know it's safe and effective, but persons that are still being followed from the studies, they're about probably about 8 months in now. That's what they're going to determine. Do we need another dose? Do we need an annual dose like we do for influenza? So they're looking at those immune responses that persons are having and how long they last. We don't know the final answer to that question. It would be nice, say, hey, we could compare, with the influenza, but it's different. It's technology. It's a different type of use of this vaccine, or the way it was created. So I just don't have the answer to that. And right now they don't have the answer to that. I've heard about, boosters. You hear a lot of different things in the media as well. But, I'm just going to continue to follow the evidence, and we'll see what happens.
Thank you. So after I get my second dose, how long will it take for the vaccine to begin protecting me? And I think the question that most people want to know is, after we seemingly all get our vaccine, do we have to continue to wear the masks that nobody enjoys?
No one enjoys it. I don't either. But I've even gotten to the fact where, I don't know if you all have seen them, but there's a little bit of silicone mask that you can put on under a mask. It helps you, talk a little bit better and have conversations, and you can just imagine that when I'm in a room with a patient socially distanced. And I say that because I've had 2 vaccines. And yes, I still have to wear a mask. And yes, I will still have to socially distance. And I will still use my hand hygiene. We will not be able to stop these things that we have so diligently been doing, because we need herd immunity. So we're going to need, most people to get their vaccines, so that we can create this immunity in our communities, so that we eventually can get back to some kind of normalcy. Now, the immunity began when we received our first one, or I should say the immune response, probably with my first one, and I'll say for Moderna. Some of the evidence shows that about 8 to 10 days after that first one, I had about 80% immunity. That's pretty good. The influenza is about 74%, so that's really good. But if we want the highest form of immunity, you need the second dose. The second dose, once you get that second dose, to get to the 95%, it's going to be about 10 to 14 days outside of that second dose that you should see that highest immunity develop. So 95% of the time, I should be safe, or from getting COVID-19 illness or severe disease, which leads you to go into the hospital. Now, what we don't know, this is another don't know right now, is whether or not once we do receive our vaccine, will we be carriers? Could we potentially have an asymptomatic infection? That's why you see the numbers, building up with asymptomatic persons carrying, COVID-19. So that's why we need to continue to wear our mask, social distance, and use the hand hygiene that we've been taught to do.
Yes, we certainly have been taught. It's very good. I do want to remind those watching on Facebook Live, if you have questions, just type them into the comment section and we'll get them asked for you. I want to combine a couple questions that we received. If you could just talk a little bit about women who are pregnant or plan on becoming pregnant or breastfeeding. Do they have any concerns, or are there any special things that they need to know about before considering the vaccine?
Well, what I'm going to say first is with any health condition, we should always talk to our provider. Talk to your physician, your provider about your health condition that you may have. And there are still studies going on. There's going to be a pregnant, I believe it's Moderna that will be doing pregnancy. So they'll have more information on pregnancy and whether or not it is a concern. At this time, because of some of the persons that were in the studies that were pregnant, they have not seen any, concerns with pregnancy. But we need to realize, and I mentioned this earlier, like with persons who had COVID, um, are you in a situation where you are at a high exposure? So with pregnancy, if you're in a situation, if you're a healthcare worker, yes, I would get the vaccine. But if you're in a situation where you're not an essential worker, if you're, maybe you're working remotely from home or you're able to be at home, then, maybe not, maybe you don't consider the vaccine and maybe you get it at a later time. If you're considering pregnancy, now they don't have any formal data on infertility, but the way the vaccine, like I said again, this is not a virus. It's not made from DNA or genetic material, so it should not affect pregnancy in the future. Breastfeeding, again, there's no known data on that. So you have to really, talk to your physician, make a informed decision, a shared decision. Are you in a situation that's going to put you at high risk? Because, if you're at risk with comorbidities or other chronic diseases, then you may not want to be in that position. You don't want to be at risk, for COVID-19. So those are some challenging decisions to make, but I would make them with your healthcare provider. And if it's with us, I'll make it with you.
I think that's great advice for most medical issues, to talk to your doctor and make those decisions. So I just got this one text to me. So if I get sick after my first dose of the vaccine, should I still go get the second dose?
Now, that depends on how sick were you? So we are going to most likely get some type of side effect, which are common. We know that. Now, if you had a severe reaction to the first one, then no, you should not receive the second one. When I say severe reaction, did you have to have an EpiPen? Did they have to use the EpiPen? Also, before you get the first one, if you've had any type of severe reaction or a EpiPen usage before, or you carry an EpiPen, then you might have to be monitored a little bit longer. The monitoring after the vaccine is 15 minutes for common, we'll say hypersensitivity reactions, and to see if any severe reactions occur. And if you've had outside, not from the COVID-19 vaccine, but from any other, maybe penicillin or some other allergy, then you would be monitored 30 minutes. But if you had any severe reaction to the COVID-19 vaccine, no, you should not receive the second dose.
Thank you. So I'm going to give a shout out to one of our chamber ambassadors, Bill. He asked, his arm hurts from his shot yesterday. Can he take any pain medicine and what is recommended?
Oh boy, I have a lot of tips for that one. When I had my second dose, I had my second dose Saturday, and I could tell that my body was making a good immune response to the first one. My arm, it hurt. So I will say it hurt. And so pain, you can talk about Tylenol and ibuprofen. Tylenol, ibuprofen, as long as you don't have any reason, stomach upset that you can't take that you can use over the counter as directed. I just alternated that all day long, and it passed. So still have a little soreness to touch today, but I got through it. The other things you can do is when you get your vaccine, make sure that you use your non-dominant hand that you get your vaccine. So when you are trying to work, especially if you're on the computer, or you won't have to use that arm as much. Or I found, even difficulty even trying to, take my jacket off when I got home. So, just use your non-dominant hand. You can use some ice on that site as well. So that's very common. When you get your vaccine, you're going to roll up your sleeve. Make sure you wear something loose. Something loose that you can easily roll up. Don't have to pull up your sleeve or pull it down. It just makes a better positioning for the vaccinator.
Great. Bill also asked, I assume he got the Pfizer. He said he was told to come back in 21 days, and he wants to know if he could come back in 20 or 23 days.
So right now, that's a really good question, because people are, concerned about whether or not they'll get that second dose. So Pfizer is a 21-day dose. Moderna is 28. So those are some of the small differences, but there's still two doses. For the Moderna, I will say there's a 4-day grace period, so you could come a little bit earlier. Pfizer also has, I believe, a 4-day grace period that you could come a little bit earlier. Now, can you come later? Yes, you can. Right now, what they've shown with the studies, and I like to quote that because it's easier to say studies, but it's the evidence that these vaccines can be given up to 42 days later. Now, remember, just as you saw all of the rapid changes with COVID-19 as it entered into our lives, we will see the same with the vaccines. So that's based on, how the studies or how the persons that we're following in those studies are going. So right now we see that immune response is probably 42 days out. That's why they're saying the second dose can be delayed as long as the 42 days. But make sure you get your second dose. That's the most important.
Okay, Bill, she was talking to you. Make sure you get your second dose. Can you talk? And we know a lot of people are unemployed or even underemployed right now. Can you talk about whether or not there's a cost to the individual for this, and who's paying for this?
So there's no cost associated with this. There's no cost associated to the person with testing either. So, when you have symptoms, you need to get tested. That should not be a deterrent. And when you get the vaccine, cost to you should not be a deterrent. It's unfortunate. I've seen opportunists out there, fraudulent behavior, trying to sell a vaccine. So if somebody's trying to sell something to you as far as vaccination is concerned at this time, it is not a cost associated with it. So these costs are being picked, we should say, at a federal level. that's where those costs are being for the administration of the vaccine. So at the federal level, not at our level.
Thank you for clearing that up. So that's one more hurdle people can not use as an excuse to not go get
Yes.
vaccinated. So can you talk about who can get their vaccine now and who might need to wait? And for those, I'll say younger, healthier people, how far down the road do you think they're going to need to wait?
Well, I mentioned a few persons in the beginning. I think when you asked a question about if you'd had COVID-19, so maybe that person could wait. But the healthy person, probably will not be able to get their vaccine maybe until later toward the summer. Again, we're going to watch for availability for the vaccinations to occur. Now, who can get their vaccine? Operationally, we would like to see, certain phases at this time get the vaccine. That means healthcare workers and persons that are 65 plus, and those that have certain chronic diseases. We're talking about, diabetes or asthma, COPD, hypertension. Actually, in pregnancy is grouped into those that should be getting their vaccine. We also have essential workers that are still in that 1B, which includes include the teachers, the educators. Those are important. Now, I go back to limited availability. At this time, it's important for people to get registered where they can when those vaccines, where they see those tools come out for registration, and those entities, and we're one of them that are vaccinating our patients, our healthcare workers, our first responders, but we only get a certain amount of allocation. When we get those allocations, then we will vaccinate more. We have the capacity to vaccinate a significant amount of persons, but we need vaccine. So we're working now with officials, and I am just excited that that we will hopefully in the future be entrusted to do so we can get our community vaccinated.
And you mentioned signing up when we were talking the other day preparing for this. You suggested to sign up as many places as you can. You want to kind of elaborate on that for those tuning in?
Yeah, yes, I said that because I said sign up as many places as you can, depending on where you live. As I watch, say for instance, Brazoria County's allocations come through, they're going to be pharmacies that are sometimes they come through weekly. So sometimes it's the health department, sometimes it's the pharmacy, sometimes it's your hospital. Now, your hospitals, you can't just go and ask for a vaccine, but if you've been a patient there in the past, you may have access to a vaccine. So if you are in that phase, 1A, 1B, some of those things, some of those classifications that I named, I would recommend, signing up, registering at those different places, because your turn just may come at one of those places with the limited availability. Again, you will see the opportunities usually at different places, weekly. They may alternate when one has vaccine allocation and another entity may not have vaccine allocation. So that's why I recommend, that you can do that. But one tip though, if you do get called when it's your turn, please cancel your registration at the other place so that you can give someone else that turn.
That's a very good tip. And I was in a meeting this morning and spoke to someone with the county health department, and they mentioned that they're just getting inundated with calls and they're bringing in extra staff. So don't get frustrated. Keep trying. We are going to get to everyone. Obviously, there are challenges with this, and it's new, and we appreciate those people that are working very hard to help get that done. We're wrapping up, and the questions are starting to die down, but I do have a couple of more just to, so if you're on Facebook Live right now and you have a question that you're dying to ask, go ahead and hit it now and we'll get it asked for you. But one question that we were sent was, will getting the flu vaccine protect me from COVID-19? But I think it's also a good time for you to mention, prior to this pandemic, there were other issues with people. So you maybe want to mention not skipping your regular appointments and things just because of COVID. So, continuing to go to your doctor, I assume, is still a good idea, right?
Yes, yes, it is. It's still a good idea. When we didn't know as much as we know now, medical care, we all stepped back. They shut us down. I mean, they shut down except essential persons. And I was, Community Health Network, we kept working through the pandemic. And we did that. We were able to do that because we were able to go to virtual care. So we were still able to give our patients what they needed. Now, did we get inundated with calls about COVID-19? Yes, we did. But we've learned now that we can do other things. We screen persons, and they can do this at your doctor's office, screen persons to see if they need in-person care or virtual care. So it's just been a challenge in the beginning, but the ability to be agile and pivot and still give healthcare during a pandemic when it's most needed was the most important thing that I think that we could do. Now, the flu is interesting. It hasn't been that common this year. COVID-19, that's all we're seeing. We do see a lot of flu, but I'm hoping that it's because I know we're encouraging persons to get their influenza vaccine. And so I'm sure everybody else is. It's recommended that you do get your vaccine. Now, if you do get an influenza vaccine, that you should wait. The recommendation is 14 days between a COVID-19 vaccine and an influenza vaccine. The reason being is we want you to be protected, for both. But if you get both at the same time, then we won't know if you have COVID-19 or possibly the flu. Because remember I said sometimes the COVID-19 vaccine, can give you body aches. You might have low-grade fever. Those are just common little side effects. With the same thing with the influenza. So it's important for us all to continue our care during this pandemic, regardless. A lot of the prevention had stopped as well. All of those things are ramping back up again. It's because we've learned how to be safe, to do the things we're supposed to do diligently, wear our mask, social distance, and hand hygiene. Plus, you can check and see if you're going to your doctor's visit, which we do as well. Make sure that they're cleaning and sanitizing in between visits, and those type of things are important to check on. So, don't stop your medical care. Don't be fearful of it. And if you are fearful of going in, find a virtual visit that you can do. There's so much that we can do as physicians through, just like we're doing now, right here, on a virtual call. We can talk. We can do an examination. There's certain things that you can do to help assist us in doing that exam. So it's important to continue your medical care.
That's great advice. I think the virtual meetings and virtual doctor's appointments and virtual school it's one of the best things that came out of the pandemic. There haven't been a lot of good bright spots, but we appreciate that one. And this is going to be our last question. We seem to have run out of what people are sending in, but this one's from Dan, whose dad is up for a kidney transplant. He wants to know If you have been a transplant patient, can you get a vaccine due to having immune compromised systems based on the medicine you're taking? And we also had some, just maybe in general talk about the immune compromised population.
Yes, we'll generally talk about, that's a good question, Dan. Generally talk about immunocompromised as well. That's another question that definitely needs to be discussed with your healthcare provider, and speaking with them and making an informed decision. But we also know that you're going to be the most, immunocompromised, you're going to be the most vulnerable for COVID-19. So it only makes sense to get a vaccine. But there's certain times when you can receive it, based on your immune system. So I think that question is going to be best answered because it's relevant to what's going on in the disease process at the time by your healthcare provider.
Okay, I'm going to sneak one more in there, but we got another question from Bill. He had his flu shot early this year, back in September. He wants to know if it'll wear off before winter's over.
So usually, it's an annual influenza. So if it's been a year, then you need your next one. And you said exactly when was it, Bill?
He said September.
September. Yeah, so he should be good. He's a September into this next September when we start up again, giving the new one.
Great. We want to thank Bill, and we want to thank the rest of the folks that have tuned in. We also want to thank you, Dr. Poindexter. We know you're busy, and as with all of our healthcare folks are right now, we really appreciate Community Health Network for what you do for our community and for what you just did for the chamber. And thank you and specifically. But we're going to turn it over to Israel Garcia. He's the Business Development Manager for Community Health Network, and he's going to talk about some of the other things, non-COVID things that they can help you with. So, Israel?
Thank you.
Hello, welcome everybody. I'll be quick. I'm going to go ahead and share my screen so that you can see what we're doing. In addition to COVID-19, we're doing a lot of other innovative things that are interesting. So looks like we're having some issues sharing the screen. So I'm just going to go ahead and talk real quick about what we're doing. We've been in existence since 2008. Our official name is Stephen F. Austin Community Health Center, but our DBA is Community Health Network. And to give you an idea of how many patients we've served over the last 2 years, in 2019, we ended the year serving 19,831 unduplicated patients. That basically means that they've accessed one of our services for the first time. And then we ended that year serving 75,052 clinic visits. And then in 2020, which was a very big year for us, we ended the year serving 31,000 unduplicated patients and providing care to over 94,000 visits. So it's exponential growth. We do have 11 health centers, most of which are in Brazoria County. We have 3 locations in Alvin, 1 location in Pearland. Newest locations are in Galveston County and in our Scarsdale location. Some of our services, of course, as Dr. Poindexter mentioned, are obstetrics and gynecology, women's health. We do pediatrics and well-child exams, as well as adult exams and acute exams. Something new this year that we are starting is men's health. So we are moving forward with that. It's very exciting that we're moving into that. So we're very excited about that. Our general dentistry, our prosthodontics, and then also we do a lot of behavioral health and mental health. Our mental health program alone in 2020 grew by more than 36%. Partially that's related to what's been going on with the pandemic and the stress that it has caused on a lot of individuals. We have pharmacy services. 3 locations have pharmacy services through a Class A, which is our Adu, Freeport, and Scarsdale clinics. And this year we'll be expanding Class A's to our Pearland, Women and Children's in Alvin, and our Victory Lakes in Lake City. And then of course we also do eligibility enrollment. So if you have patients that are uninsured, we do have programs available for them. But if you have individuals that need help being re-enrolled into Medicaid and Medicare, we can also assist in that too. One of our strengths is collaboration. We partner with more than 30 social service agencies, including the Episcopal Health Foundation, the United Way of Brazoria County, Galveston County mainland, and Bay Area. And then we also partner with the Houston Food Bank. We have very good relationships with our hospitals. We work extensively with Memorial Hermann Southeast and Pearland. Very grateful for them. CHI St. Luke's, Brazosport, our HCA Houston hospitals, Clear Lake and Pearland, and then of course, a great partner is University of Texas Medical Branch, UTMB. We have integrated health centers, and the Dream Center includes Brazosport College, which is new. We also have something very new is we are integrating mental health services in the Brazoria County Alliance for Children, and then Gulf Coast MHMR. We also partner with the county for natural disaster and pandemics, and then we also partner with Alvin Community College, Brazosport College, and Alvin ISD CTE programs on workforce development. Really quick, we focus a lot on innovation at Community Health Network. We've developed our own EMR system, our own telemedicine system, and then our own seamless mobile applications for registration and our patient portal access. This year, we're piloting something that's very exciting. We're doing home care for vulnerable populations. We're developing a platform that will enable us to provide remote monitoring services for patients with high comorbidities such as hypertension, hyperlipidemia, diabetes, as well as some other high comorbidities. And also 2 more fun facts. Number 1, our behavioral health virtual visits are now 90% of our behavioral visits are virtual, and 60% of our medical visits are also virtual. And then lastly, of course, we're very excited about this. We received a grant about a year ago to be innovative with dentistry. And so we purchased a 3D printer. And over the last several weeks, we've been piloting 3D printing, 3D prosthodontics through the use of a 3D printer. So those are some of the things that we have going on at Community Health Center, Community Health Network. We're very excited to be a part of the Alvin community for the past almost 13 years. We've grown by leaps and bounds, as you can see how many patients we have served. So as Dr. Poindexter mentioned in the vaccines, we are partnering with our local health officials as well as our other hospital partners to ensure that we can reach as many individuals that need the vaccine. More information will be coming out soon as to when more vaccine events will occur. So please stay tuned to our social media page, as well as if you have any questions, access our webpage as well.
Thank you, Israel. We really appreciate that. And Dr. Poindexter, thank you to you again. I also want to thank Carrie Perrin, our operations director, for making all of this technology work today. And hopefully you didn't hear the trains too much as they go by our building, but I know that there were several that went by in the past half hour, so you probably did. But we really appreciate all of you that tuned in. If you're interested in more healthcare issues, we have a February 16th Chamber luncheon, so you can go to the Chamber website and learn more about that. And lastly, Israel and Dr. Poindexter, I want to thank you. Community Health Network has been a member of our Chamber of Commerce for the past 12 years, and we certainly appreciate that, and we appreciate what you're doing to help get the word out. So again, I think I can reiterate, no one's here telling anyone to take or not take the vaccine. We just want you to have the knowledge to be able to make the decision yourself, or better yet, with your doctor. So thanks everybody, and we hope you stay safe and enjoy the rest of your day.